So dear students, so already in the last class we learned regarding the endocrine system. So how the glands, so they are categorized into two types regarding exocrine and endocrine, then types of hormones, then what is the role of the hormones, how the hormones can regulate the physiological role of functions of our body. So hormones, so they having the variety of the functions. Even the aging is also depending upon the hormones. Any abnormalities in the hormones. So early age, so they look like a old. If having the good hormones, secretions at normal level, then you are free from the aging also. Okay, so hormones level that was mainly depending upon the intake of the food or quality of food or micronutrients and scenario or status of the brain. You are free from the stress or agitations or depressions or any other CNS problem, then hormones level are normal, then you look like a youngs and you look like a fresh. And meditation is also influence or helpful for to normalize the hormones level in our body. So that's why daily you can do the meditations, daily you can take the healthy food and avoid the junk foods, then you are always, you are the healthy and you are free from the various kind of the metabolic disorders. So nowadays, so every person, so they will be having any one of the type of the metabolic disorders. Some people they having the problem in the digestion, some people they having the gastric hurrying due to more secretion, some they having the problem in the kidney, some they having the problem in the brain or liver or many other organs are there. So these are all are the metabolic disorders. They are of course due to imbalances of the micronutrients or imbalances of the CNS. Due to that, the hormones level can be altered, then they are suffering from the various kind of the disorders. And also we learn regarding the certain important terminology regarding the neurohormones, neurotransmitters, neuromodulators, pheromones. In future, so these terminologies is helpful for you to identify the target for your drug, target for your therapy. If you are familiar with the neurohormones, familiar with the neurotransmitters, familiar with the neuromodulators, so then you are able to find out your target. Okay, for example, already I have told to you GABA can regulate the sleep. GABA is helpful for to induce the sleep. The GABA level is less in morning and more in evening or night times. Okay, so due to that in the night time, so we can got the sleep. Okay, so then you having an idea regarding so which neurotransmitters, so they are involved in the regulations of sleep. Then if any your candidate, your patients, if that candidate having the insomnia, that is the sleep problems, he do not or she do not got the sleep, so there is a problem. So that condition is known as the insomnia. So now directly if you are using the drug means, then the dependence was developed. So every time the patient is required the medications, and each and every medication they are harmful. If you taken excess of medications, then your conditions are normal, but medications related disorders, ADR, so that candidate was suffer. So that's why, so as the ideal formed candidate or clinical pharmacist, so their main motive is to normalize the abnormal physiology through a food, through a technique, through a therapy. If it is not possible, then you can administer the drugs, because your aim is not to treat the disease. Your aim is to improve the quality of life of the patient, because everyone they can give the medications. Doctor write the medication, then everyone can give the medication and everyone can take the medications. But what about the quality of life during the therapy or after the therapy? So that is the rule of the clinical pharmacist. He can give the life to the medicines and as well as improve the quality of the life when, so they are familiar with the components or they are able to find out the risk factor and target for your therapy or medication. So that's why, so these terminology, the related topics in the future we will learn, so they are helpful for to find out a target or to achieve in the success rate in the that is the in the therapies or in the treatment. And also we learn regarding the different types of the endocrine glands with their secretion, and also we learn regarding the master gland or pituitary gland. So how the pituitary gland can receive the inputs from the various parts of the CNS and involved in the regulations of the normal functions of the human body or functions of the human body, because it got the information from RAS, thalamus, limbic, cerebral cortex, internal organs as well as retina. So these all are, so they are helpful for to regulate the body functions. Then where we require some supply of nutrition, changes of environment of the organ or need to fulfill the need of the organ to work according to that change in the physiology. So that was fulfilled by the pituitary gland. That's why the pituitary, that was helpful for, because of the pituitary gland, it can receive the inputs or message from RAS, thalamus, limbic system, cerebral cortex and retina, internal organ. So that's why immediately in shorter duration, in millisecond, it was adjust the blood pressure. Millisecond, it can adjust the rate of respiration. Millisecond, it can adjust the metabolism and helpful for to supply the ATP within millisecond. Okay, so that is the one of the main advantage of the master gland or pituitary glands. Then also we learn regarding the how the pituitary glands or hormone they are classified. So according to the location or according to the part from which so they are secreted, so they are mainly classified into three types: anterior, that is anterior pituitary hormones secreted from the anterior lobe, posterior pituitary hormones secreted from the posterior lobe, and between anterior and posterior that part was known as the pars intermedia. So these three parts, so they are secreted the hormones, and among them, so these anterior pituitary hormones, so they are synthesized in the anterior lobe only and secreted from the anterior lobe itself. And posterior pituitary hormone, they are synthesized in the neurons or nuclei of the hypothalamus and stored in the posterior pituitary gland and released from the posterior pituitary gland. It means they do not synthesize in the posterior pituitary gland, only they are stored and released. Then as well as the pars intermedia, it can stimulate, release the MSH, so that MSH is required for the enhance the synthesis of the melatonin, and that melatonin is required for the regulations of the circadian rhythm or biological clock. So that's why pituitary gland, with the help of their secretion, it was involved in the regulations of the various body functions. And also we can know the mechanism beyond the regulations of the pituitary hormones. Like there are two mechanisms, one is indirect control, it was helpful for release of the hormones from the anterior pituitary, and another is the direct release of hormone due to sensory stimuli or chemoreceptor stimulation, that was helpful for the release of the posterior pituitary hormones. So now today we learn regarding the anatomy and physiology of certain important hormones comes under the pituitary glands, or we can learn regarding the anatomy and physiology of the pituitary hormones. So first one is the growth hormones. So growth hormones, it is an example for anterior pituitary hormone. Okay, so it was secreted from the somatotropes. So somatotropes are the special type of cells, so they are found in the anterior lobe of the pituitary gland. So those somatotropes, so they receive the hormones from the hypothalamus in the form of the GnRH. Okay, that is the growth hormone releasing factors or releasing hormones, that is the GnRH. So that was released from the hypothalamus. So that was reaches to the somatotropes. So then only somatotropes, so they are involved in the synthesis as well as release of the growth hormone under the influence of the hypothalamus or depending on the releasing factors from the hypothalamus. So that's why the release of growth hormones, so that was mainly influenced by the hormones are hypothalamic hormones. So regarding the growth hormone, so growth hormone is a protein hormone. It is made up of the amino acids, around 191 amino acids. So they are utilized for the formations of the growth hormones. And regarding the molecular weight of the growth hormone is 21,500, and daily output, that is the daily synthesis and secretions of the growth hormone from the somatotrope or pituitary gland is, that is 0.5 to 1 mg. And regarding the plasma level, the children having 300 nanogram and adult having 500 nanogram per deciliter per 100 ml in our blood. So the children having 300 nanogram and adult having the 500 nanogram. Okay, so regarding the biological T-half, within 20 minutes, half of the released growth hormone, so that's metabolized or removed from the circulations, because it T-half is only 20 minutes. And growth hormone, it was released by a somatotropes by a certain feedback mechanism, and those feedback mechanisms is mainly categorized into two categories. One is a positive feedback mechanism and second one is a negative feedback mechanisms. So positive feedback mechanism is activated. So when the growth hormone level in the plasma, it is less than this level. Okay, it is less than the normal level. Certain chemoreceptors, so they are present in the plasma or in the blood vessels. So their main motive is function is, so they are monitor the plasma concentrations of the growth hormones. So when it was decreases, so then they give the signal to the cerebral cortex. When the growth hormone level in the plasma or in the blood that was decreases more than the normal, so they can use the sensation or stimuli to the cerebral cortex. Then cerebral cortex, it can integrate the message. It can find out the solution or answer. If you are under the stress, you are under the depression, so on that time cerebral cortex was failed to find out the answer for problems. So that was came from the sensory receptors or chemoreceptors. So that's why the conditions of the brain that was influence on the release of the hormones. So due to got the message from the sensory receptors and as well as chemoreceptor, cerebral cortex find the answer and give the answer to the hypothalamus. Then hypothalamus gather information from the cerebral cortex. Then it was involved in the release of the growth hormone releasing factor. So that factor is secreted into the entire pituitary loop. Okay, so then it can reaches to the towards the somatotrope cells. Then the somatotrope cells, so they are involved in the release of the growth hormones. So this phenomena is known as a positive feedback mechanisms. When it is more than normal level, when the growth hormone level in the plasma is increases more than the normal, so on that time, so the negative feedback mechanism can be activated. It is helpful for to decrease the elevated growth hormone in the plasma. The phenomena is same. Once again chemoreceptor detected, send information cerebral cortex regarding so hormone level was increases. Then cerebral cortex release the that is inhibitory. No, sorry, it can give the message to the hypothalamus. Then hypothalamus, it can stop the release of GnRH, the growth hormone releasing factor. Instead of that, it can send the growth hormone inhibitory factors. Due to that, the somatotrope can stop the release of growth hormone. So like that, the positive feedback mechanism and negative feedback mechanism, so those are involved in the secretions or regulations of the all type of hormones, including the growth hormone. So that feedback mechanism is known as the homeostasis mechanism. So with the help of the positive and negative feedback mechanism, so all the hormone level in our body, So they are normalized. So regarding the physiological role of the growth hormones, so dear students, the growth hormones, it's mainly involved in the to increase the retentions of the calcium. Okay, it can inhibit the excretions of the calcium from the kidney through a urine, and as well as it can enhance the depositions of the calcium or absorptions of the calcium on by a bone. One side it can inhibit the excretions of calcium, and another side it can enhance the depositions of calcium on a bone by stimulating the epiphyseal cartilage. Okay, so epiphyseal cartilage, it is one type of the cartilage, okay, connective tissue. So they are found on the head of the bone. Its function is it can absorb the minerals from the blood and involved in the development and strength of the bones. And here the growth hormone, it can stimulate the functions of the epiphyseal cartilage. So due to that, they can increase the mineralizations of the bone. Then the height of the bone is increases under the influence of the growth hormones. So that's why the height of the bone is mainly depending upon the, or height of the person is mainly depending upon the amount of release of the growth hormones. If any early problem in the life during especially 9 to 12, if any students having the stress or depression, so then so their height was restricted. If were, so they are free from the problems, so they are free from the stress or free from the depression, definitely. So their height was increases due to normalizing the feedback mechanism or release of the growth hormones, because that was required for the two mineralizations of the bone. One side it can inhibit the excretion, and another side it can enhance the absorptions of calcium. Due to that, it can strengthen or increase the mineralizations of the bone. And the growth hormone is also increases the muscle mass through a sarcomere hypotrophy. That is, once again, the sarcomere is a special type of the cell or component of the skeletal muscle. The strength of the skeletal muscle is mainly depending upon the number of the sarcomere or conditions of the sarcomere. And here the growth hormone, it can cause the hypertrophy. Hypertrophy is nothing but accumulations of the cells or accumulations of the fluid or increase the size of the cell. That was the hypertrophy. It was caused the hypertrophy of sarcomere. So due to that, the muscle mass is increases. So that's why under the influence of the growth hormone, the muscles will be the strengthened due to causing the sarcomere hypertrophy or enhance the size of the sarcomere or special type of cells of the skeletal muscles or muscles. And also the growth hormone, it can promote the lipolysis, that is the breakdown of the lipids or metabolism of lipid. So due to lipolysis, more free fatty acids are available, and those free fatty acids, so they are undergo the beta oxidations. So due to beta oxidation, so the more ATP is produced, so that ATP is helpful for to nourish the body or helpful for various biochemical reactions. Especially it was helpful for, it was required for the protein synthesis. So that's why the growth hormone, it can enhance the protein synthesis by increasing the supply of the ATP by enhancing the beta oxidation. And another side, it can increase the protein synthesis by decreasing the excretions of the nitrogen. So nitrogen is a basic molecule. It was play an important role in synthesis of amino acid and synthesis of protein also. So that nitrogen only it is helpful for to form the peptide bonds. Okay, so that nitrogen excretion is decreases. It means the growth hormone, it can cause the positive nitrogen balance in our body. So due to positive nitrogen balance, the protein synthesis is increases. In another side, the growth hormones is also enhance the turnover of amino acids. Nothing but it can enhance the to transport the amino acids from extracellular fluid into the inside the cell. Then more amino acids inside the cell, the cells can utilize the amino acids and involved in the synthesis of protein, and that protein is required for the growth and development of the body. Okay. So here the growth hormone is also stimulate the growth of the all internal organ excluding brain. The growth hormone, it can influence the or increase the growth of all organ except the brain. Okay. So next, through a once again by involving in the synthesis of the proteins, and it is also play an important role in the balancing of the internal environment. So that was known as the homeostasis. So growth hormone, it can decrease the liver uptake of glucose. It means it can inhibit the glycogenesis, that is the synthesis of the glycogen from the excess of the glucose. So that's why, so over secretions of growth hormone, so that person was suffering from the diabetes mellitus. You commonly seen. So those people, so their height is more, definitely. So those people, they will be the suffering from the diabetes mellitus. And also the world tallest person, so he is from the Pakistan. Okay, around 7.8 feet his height is there. So that candidate is also die due to diabetes mellitus only, because so their height is more because of the more growth hormones, and as the growth hormone increases more, then it can decrease the regulations of glucose, that is inhibit the synthesis of the glycogen from excess of glucose by inhibiting the utilizations of the liver or uptake of glucose by a liver. So that's why, so more glucose is present in the blood. So due to that, that candidate was suffering from the status diabetes mellitus. Then as the sugar level is increases, the RBC functions can be altered. Okay. So then alter the RBC function, the supply of oxygen is decreases, then the organ was deficiency of oxygen, the organs cell, so they are suffering from the necrosis. So due to necrosis, the organ was failed. Due to failure of organ, the death is confirmed. So that's why the over secretions of the growth hormone, definitely, so that person was suffering from the diabetes mellitus. And also the growth hormone, it can promote the gluconeogenesis in the liver. One side it can inhibit the glycogen synthesis, and another side it can enhance the synthesis of glucose from the non-carbohydrate source by utilizing the ATP ketone bodies or by utilizing the amino acids, where that was known as the gluconeogenesis. So that process was increases. Once again the blood sugar level is increases, then it can respond to cause of the diabetes mellitus. Okay. And also it can contribute the maintenance and functions of the pancreatic islets. It is one of the good beneficial effect. It was involved in the to maintain and regulate the functions of the pancreatic islets. And also the growth hormones, it can stimulate the immunity. It is one of the another beneficial effects of the growth hormone. It was stimulate the immunity. And growth hormones, it is also cause the deiodinations of T4 to T3. So in our body, the T3 having the physiological role, then T4 it do not having. And here the growth hormone, it was increase the deiodination or conversions of T4 into T3. So that was required for the to show the thyroid functions or the growth and development of the body. So these are the various physiological roles, so regarding the growth hormones. So next one we can discuss regarding the ACTH, so also known as the adenocorticotropic hormone. So ACTH is also hormone from the entire pituitary gland. It is also secreted from the special type of cells. So those are known as the corticotropes. So here the ACTH is a polypeptide hormones. It consists of 39 amino acids, and the synonyms for the ACTH is known as the adenocorticotropins and corticotropins. So regarding the release of ACTH, So that is also decided by the hypothalamus. Hypothalamus, it can release the CRH, that is the corticotropin releasing factor or releasing hormone. So that factor was reaches to the enter pituitary glands towards the corticotropes cells. Then the corticotrope cells, so they are release the ACTH. Then, so this ACTH acts on the adrenal cortex, then involved in the release of the mineralocorticoids and glucocorticoids. It means the ACTH, it was required for to regulate the functions of the adrenal cortex or adrenal glands. So regarding the actions of ACTH, so in the adrenal cortex, the ACTH, it can stimulate the release of mineralocorticoids and as well as the glucocorticoids. So mineralocorticoids, as the name indicates, so they are involved in the mineralizations or regulations of the minerals by inhibiting their excretions regarding sodium, calcium, so water. Okay, so those are their excretion is inhibited. So that's why the ACTH is also involved in the regulations of the minerals or electrolytes in our body, and also it can stimulate the release of the glucocorticoids. So glucocorticoids, so as the name indicates, it was involved in the regulations of the glucose. So when the body having the deficiency of glucose, so then the glucocorticoids, it was continuously involved in the to supply up the glucose. So that is the role of the glucocorticoids. Okay, and also ACTH, it is used as a diagnostic agent to assess the functions of the adrenocortical pathway or adrenocorticals, how the adrenal cortex can work, or to know the scenario or conditions of adrenal cortex through a monitoring the ACTH level in the blood. If its level is increases more, so that can denote the malfunctions of the adrenal cortex. Okay, and also the ACTH is helpful for to note down the stress condition in the body. During the stress, the ACTH level is also increases. That is also targeted for the identifications of the stress by chemical procedure. If the patient's not ready to tell, but he having a stress, because no one can correctly inform the doctors or clinical pharmacist what they will be suffering from, whether they are having the problem, stress or not. So that is also concluded if you are not achieving your therapy. So then you can monitor the ACTH level in the blood, through which we can conclude how the adrenal cortex can be worked or how the person was suffering stress or not. Okay, so this ACTH, it is also having the anti-inflammatory actions. It means it is also helpful for to decrease the inflammations, especially. So there is no medications is available for treatment of the inflammations in the thyroid glands. That is was known as the non-supportive thyroiditis. That is also treated with the help of the ACTH, and also it was used for the treatment of the acute exacerbations of the multiple sclerosis. So because of it is having the strong anti-inflammatory activity also, that was helpful for the treatment of the inflammation. So that's why they are employed in the treatment of the thyroiditis or acute exacerbations of the multiple sclerosis. So regarding the significance, so ACTH level was increases in the case of the Addison disease and Cushing disease. Okay, so these are the brain related disorders. So that was monitored by monitoring the plasma concentration level of the ACTH. If the level was increases, so that is known as the Addison disease, that was caused due to primary adrenal insufficiency, that is the malfunctions of the adrenal cortex. And Cushing disease, it was indicate the ACTH abnormally increases, that is due to pituitary tumors or hypercortisolism. So where the person was suffering from the Cushing disease, he cannot be tolerate the temperature or cold like that, certain symptoms are there, or cognitive dysfunctions is there, mind cannot be concentrate. So these are all the signs and symptoms for additions as well as the clustering disease. So that was the diagnosis with the help of the plasma concentrations of the ACTH. So now we can go for regarding the other hormones. So they are secreted from the pituitary gland, that was known as the thyroid stimulating hormone. It is also known as the thyrotropins and TSH. So TSH, it was secreted from the thyrotropes from the anterior lobe, or it is a hormone for the anterior pituitary gland. So this TH is mainly regulate the functions of the thyroid gland. Okay, so the thyroid gland function is mainly depending upon the TSH. Without TSH, the thyroid gland cannot be secreted the thyroid hormones like a T3 and a T4. If it is secreted from a T3, T4 without TSH, so that condition is known as a thyroid cancer or thyroid tumors. But in normal physiology, the thyroid gland, it can secrete the T3 and T4. So that was really depending upon the TSH. TSH reaches to the thyroid gland, then the thyroid gland was involved in the utilizations of the tyrosine, utilizations of the iodine from the blood, then involved in the synthesis of the T3, T4. So that's why the thyroid stimulating hormone, it was required for the regulations of the functions of the thyroid gland or thyroid secretions. So next one, that was the follicle stimulating hormones, FSH. It is also interpituitary hormone. It was secreted from the special type of cells. So those are known as the gonadotropes. And this FSH, it was required for the gametogenesis and spermatogenesis. It was required for the synthesis and release of the ovum in the female. In the male, it was required for the synthesis and release of the sperm. That is especially the synthesis of the sperm. That was known as the spermatogenesis. That was influenced by the FSH. Through FSH, it can reaches to the gonadals, or it can reaches to the fallopian tubes, ovaries, or even the testes. So where they can enhance the secretions of estrogen, progesterone, testosterone. Then those hormones, so they are involved in the gametogenesis and as well as the spermatogenesis. The next one hormone, so that was known as the luteinizing hormones. It is also written as the LH. So it is required for the ovulation in female, and in male it was required for the testosterone productions in the male. So that was depending on the LH, and LH is also interpituitary hormones. Okay, it was secreted from the gonadotropes. And last one, that was known as the prolactins. So that prolactin is also the hormones of the, that is the interpituitary gland. So that was required for the lactation. So prolactin reaches to the mammary gland and stimulate the epithelial cells of the mammary gland. Then they are involved in the milk production. So that condition is known as the lactation. So the prolactins play an important role in the lactation. So that's why, so during the pregnancy, after the pregnancy, so during the lactations, so mother should be free from the stress. Okay, mother should be free from the stress. Otherwise, there is a problem in the lactations or baby feedings. So that's why, so you are the ideal pharmacist, ideal clinical pharmacist, or that is, you are the one of the ideal persons or good persons. So always, so those are pregnant or after labor, so where you can counsel them, always keep them free from the stress. So that's why in Indian culture, so that is the first labor is always do in the mother homes of that lady, because she feeling free environment in the own home, in the mother home, as compared to the husband home. That is our ancient people. So they are made such rules. The first the delivery is compulsory in the Maike, in the females, that is the mother house, because where he can feel the freedoms, freely talk and free from the many mental disorder. Then there is no problem in the pregnancy growth, that is the fetus growth, or there is no problem in the lactation due to good CNS condition the prolactin will be the good secretion. So that is one of our ancient therapy. So that is one of the our ancient therapy. So now we can discuss regarding the oxytocins. So dear students, so already you are familiar with the oxytocins. Simply, it was required for the inductions of the labor. So once again, so this slide you can give the one important topic for you, because nowadays so there is no normal labor. Always the people they can go for the scissoring or operation for to induce the labor. Why? Because so that lady do not have the sufficient concentrations of the oxytocin. Oxytocin, it is the posterior pituitary hormones. Oxytocin, it is a peptide hormones. It is a protein hormones. Then during the pregnancy, there is a development of the fetus is there. So during the pregnancy, the protein required more in the pregnant woman as compared to the normal women, because there is a womb is developed. So that womb is required the more proteins, and proteins, so they are synthesized from the amino acids. And here also the oxytocin is a peptide hormones. But during the pregnancy, so to nowadays that is the mechanical work is there, mechanical pressure is there. Okay, so nowadays the female they are conscious regarding their figure, so they are never take the balanced nutrition. What are the nutrition the doctor they are advised? What are nutrition the clinical pharmacists they are advised? So where the females or that pregnant woman they do not take because of lack of conscious, lack of awareness why the proteins are required during the pregnancy. So the easily thinking the doctor unnecessarily the writings. Okay, I am healthy. Okay, but still the doctor return the proteins food, because the doctor aim is to balances the protein level in the body by supplying the amino acids through a food. So that protein is also required for the synthesis of the oxytocin, and oxytocin is required for to cause the labor pain. So without labor pain, the labor cannot be occurs. If the lack of labor pain, so the doctor they can go for the operation or scissoring, because there is a chance of the death of the womb or the death of the mother due to lack of the pain. So that's why if you want to your neighbors, your friend circles, yourself or your area people or your patients, so they are free from the seizures, then always tell to them so they should be utilize the good sufficient source of the protein so during the pregnancy. But they take the protein but they do not have the sufficient hemoglobin. Okay, so hemoglobin for female is that should be the 14.5 or 12 to 15 gram per deciliter. And hemoglobin is also play an important role in the protein synthesis, because each and every step of the protein synthesis they require the oxygen, and oxygen is supplied by the hemoglobin, and hemoglobin is also one type of the proteins. Okay, if lack of oxygen, that was, so there is no biochemical process can take place. So that's why so there is need to maintain the hemoglobin level in normal in the case of the or in the during the pregnancy. So these are the lot of reasons. So due to that, the doctors so they give the iron supplement, folic acid supplement, as well as supplement of the amino acids or protein food during the pregnancy, because they want to avoid the future problems, or they enhance the growth of the all organs in the womb or in the child in the mother womb. Otherwise deficiency of protein, the brain organs cannot be developed. Immature birth is occurs. And here also the oxytocin, it has one of the peptide hormones. So that oxytocin was play an important role to cause of the labor pain or to inductions of the labor by causing the contractions of the uterine muscle. So due to contractions of uterine muscle, so then only the labor can be inductions. Okay, oxytocin, it is a posterior pituitary hormones, but it is not synthesized in the posterior pituitary gland. it was synthesized from the hypothalamus regarding the nuclei, supraoptic and paraventricular nuclei of the hypothalamus. So those are involved in the synthesis of the oxytocin. So that synthesized oxytocin, so they are stored in the same nuclear axon. So those are present in the posterior pituitary gland. And also, so they are secreted from the posterior pituitary gland. So when they are required or due to the neurohormonal mechanism or that is sensory stimuli. So that release oxytocin, it is in the mainly, it acts as a neurotransmitters. In CNS, it acts as the neurotransmitter. That's why oxytocin is a hormone as well as it is a neurotransmitter. It is only one hormone that is acts as a neurotransmitter in the CNS. Regarding the neurotransmitter, it can transport the message regarding the dipsogen, regarding the water intake, that is dipsogen. So that message can be transmitted from one neuron to another neuron, neuron to organ. That is the role of the oxytocin. Due to that, the oxytocin is known as a neurotransmitter as well as neurohormones. So regarding the physiological role, so oxytocin in the uterus, it was increases the force and frequency of the uterine contraction. So that was required for the inductions of the labor. And in the breast, it was causes the contractions of the myoepithelium memory alveoli. So that was required for the ejections of the milk from the mammary gland. Okay, so those people, those students, so they are from the rural area, so they are familiar. So when our buffaloes, so when our cow, if we do not give the milk, then that we can go toward the doctors. Okay, so doctor they give certain injection. That is the consist of the oxytocin derivatives or oxytocin drug. So that was helpful for the ejaculation of the milk from the cow mammary glands. So in the human beings also, so the cow, it was play an important regulations of the mammary gland function by causing the contractions of the myoepithelium of the mammary alveoli. Then in the cardiovascular system, in high doses only, it can cause the vasodilatations. That is the relaxation of the blood vessel. That was decrease the blood pressure. So that's why during the pregnancy, the oxytocin synthesis increases because it is required for after 9 months to induce the labor pain. And then only the pregnant woman usually, so they can causes the loss of consciousness. It is also one of the reason because of oxytocin. So they cause the loss of consciousness because due to vasodilation, the low blood can supply to the brain. So that's why, so those are easily suffering from the loss of consciousness. For them, the doctor told they can go for the bed rest. Because bed rest, it was decrease the demand of the brain and it can need the less pressure to supply blood towards the brain. Only in standing position, we require more blood pressure to supply the blood to the brain. Okay, but in the relaxation position, the maximum pressure is transported towards the brain. Then they are free from the loss of consciousness. So that's why, so during the pregnancy, you should be advised to your patients. So regarding the bed rest where they will be having the loss of consciousness because of, so this oxytocin, it is also another property like a vasodilatation. So in kidney, once again in the high doses, it is show the ADH like action. That was, it can decrease the urine output. As the urine output decreases, the swelling of the leg is occurs. Our body can be swelled. Okay, so during the pregnancy, if the leg was swelled in the female means or in the pregnant woman means, it is not indicate there is a problem in the liver or problem in the kidney. It is due to release of oxytocin. So legs are always swelled in the month of the 8th to the 9th. Okay, the gestation period, that is the pregnancy period, 8 to 9th, where only the oxytocin secretion level is more. So that's why where only, so leg are swell. Okay, so that's why you don't worry, or you can give the knowledge regarding to your patients. So when the pregnant woman can visitate to your hospital, you can monitor all these signs and symptoms. not these signs in the pregnant woman, then advice to them. So they are free from the anxiety, so they are free from the fears. That is your role also to decrease the anxiety in the your patients. So regarding the uses, so this oxytocin is used to inductions of labor and as well as postpartum hemorrhage. Then it is also used for the breast engorgement and abortions. If any malfunctions in the mammary gland, or also the oxytocin can be used. Okay, also it is used to induce the labor, premature, that is abortions. In the case of abortion, the doctor they give the certain medication, they cause the uterine contraction. So due to uterine muscle contraction, the labor abortion is occurs. Okay, so nowadays they are using the oxytocin or oxytocin related drugs. So they are helpful for to cause abortion if that womb is unwanted, that is unhealthy, or it created the problem to the mother or any other problems. So these are the various physiological role of the oxytocins.